And I am so excited to introduce our presenter today. Danelle Hubbard is a seasoned gerontologist and social worker. She has over 20 years of experience specializing in aging, Alzheimer's disease, and other dementia. She is currently serving as the Regional Health Systems Director at the Alzheimer's Association, and she oversees initiatives across 10 states, including Utah. Excuse me. In this role, she partners with health systems to advance strategies in dementia risk reduction, early and accurate diagnosis, emerging treatments, and improving the quality of care for individuals living with dementia and their families. She is a dedicated family caregiver and an enthusiastic advocate who is committed to advancing health equity and improving outcomes for all communities affected by dementia. And with that, I will turn the time over to Danelle. You're muted, Danelle.
Okay. Hello. Thank you so much for that wonderful introduction. And I am just thrilled to be here today and to be a part of this prestigious ambassador webinar series. So thank you so much for inviting me. And today my focus will be on AlzPro, a tool to support healthcare systems, clinicians, and also community members who want to learn more about Alzheimer's and dementia from the scientific clinical realm. So today I will be covering we just did the introductions, but I'll be talking a little bit about our mission, brain health. I'll go into our clinical resources, then upcoming events, and I always like to do a brief review of our community resources, and that's when we will then open it up to questions and answers. So first, I want to talk a little bit about our mission. And really, health systems directors were created to support you and your teams with this quadruple aim of really improving the quality of care for people living with dementia and their families, as well as improving the overall clinical experience. That's something that we hear often from our health system partners is the need for support and just how overwhelming your jobs and roles are. And we really want to support you in the work that you do, as well as improving the patient experience and the clinical workflows that guide a patient, particularly in the early stages of a dementia diagnosis, as well as looking at lowering the overall cost. We know that Alzheimer's disease is the costliest of chronic conditions for particularly Medicare. So what can we do to help lower the cost not only for our health system, but also for the families that we serve? So, one of the most common questions we get as professionals is how can people improve their brain health or lower their risk of dementia? And we have known that many behaviors and conditions can affect the risk of cognitive decline in dementia. And now we have evidence that engaging in healthy behaviors can have a positive impact on brain health. And this is through our US Porter study, which I'll actually show you how to get to here shortly. That actually shows a program combining exercise, nutrition, cognitive engagement, and health monitoring can meaningfully protect brain health. And with this information, I love to share new and innovative ideas. And this is something that really came from our community partners and how we can better serve human resources and employee assistance programs at larger organizations. And so coming soon, we will have something called Brain Health at Work. And this tool is really designed to empower those human resources and employee assistant programs with brain health technology and brain health information. So again, this is new. So you're probably one of the first groups to actually even hear about this that will be released soon. So now I'm going to move on to resources for clinicians. And one of the things that I always like to reflect on is the heart of why do we do this work? And I've worked for many years as a care consultant, having conversations with families who I've heard all of these phrases numerous times where really, if they receive a diagnosis, it's something along the lines of, well, there's nothing we can do. Get your affairs in order. Families are like, I don't know what next steps to take. I'm just overwhelmed. And, the thing I hate hearing the most is, oh gosh, if only we knew about the Alzheimer's Association when our mom or our grandma was faced with this disease. And so, again, my role in work today is to really help um, really get rid of these phrases and empower professionals in being able to support families because it is heartbreaking to hear these conversations over and over and over again. So, one of the things, and I believe this is a part of the series earlier, I just wanted to give a quick reminder of a tool called My All's Journey. And this is a free and accessible app that is designed for newly diagnosed early stage individuals and their care partners. And really, this was designed for people who already use apps or are familiar with that technology. And this gives them a personalized guidance, education, planning tools, activities, resources, all in one place. I also know a lot of professionals who will actually download this app that they can utilize in clinic when discussing the diagnosis or support with families. And really, it is designed to help users navigate their diagnosis, stay connected, and take action with confidence. And again, we are looking at how can we support and really build that community around that person living with dementia and their family, as well as really fighting against stigma. And one of the things that I've been uh, just privileged to be a part of in my time at the Alzheimer's Association is really seeing a focus on how we can support individuals with living uh, a high quality, good life with a dementia diagnosis and really getting rid of the despair and hopelessness that I've seen so many families experience. So this is one of those tools. So definitely take a look at that after this webinar. But now I'm going to move on to our main topic, which is AlzPro. And AlzPro is a new Alzheimer's Association tool built with and for all professionals who have a critical role in the fight against Alzheimer's. And AlzPro is really designed to bring the latest research guidelines, training, and implementation tools in one seamless platform. So, one of the things I would like everyone on this call to do is take a moment and pull out your phone, scan the QR code in the upper right corner, and subscribe to our newsletter. This is really the hub for all the latest and greatest evidence-based um, new information, a place for questions that you may get in community from families, from other professionals. This will put you directly connected with us to receive that information in a timely manner. So I'll just pause a moment because now I will move us on to our demonstration of what AlzPro looks like and what it can do. So give me one moment as I transition to the site. Okay, are you seeing the AlzPro site? And I can't see, so just verbal confirmation would be great.
Yes, we can see it.
Okay, great. Thank you so much. So, this is the landing page when you go to AlzPro. And as you can see, this is really designed to make it very user friendly, very easy to navigate. And so, with this site, you really can find information multiple ways. And so, in looking at the content hubs, these are really the main areas. It's divided into looking at research, publications and grants, training, those professional networks and registries, conferences and events, as well as care pathway. And so, as you see, there is always on the landing page the newest report. And so, one of the questions that we often receive, particularly in community, is information around blood-based biomarker technology. And so now we actually have those clinical practice guidelines in specialty care. Something that is forthcoming is actually these guidelines in primary care. So definitely by subscribing to the newsletter, you would receive an update of when that information in those guidelines are released. And so on this page, again, you can scroll down. You could see all of the featured resources. So these are the newest offerings, if you will, of the Alzheimer's Association, as well as this tool where you can, again, search by topic, type, and purpose. So again, designed to be very easy, user-friendly. And that was the overwhelming feedback we heard about our resources, that we had so much, but sometimes it was difficult to really find what a professional was looking for or a community member was looking for. And of course, here's another place where you can subscribe. Now, if you go up to the top, and so we have very easy tools to navigate back up to the top. And this is a stagnant line. If you go to all resources, it will bring you here. And so this is another way to navigate through the website. Again, you have a landing page, but here on the left, you can actually search by content, and it actually will tell you how many resources are available related to that content. And so, again, allows you to look at what the collection of topics are, what the resources types are, as well as purpose. So again, as you're going through the site, you can navigate to multiple pages and you never get lost because you can always circle back to those main topics. And so one area that I'm going to spend a little bit more time on is something that we often hear as a need and a resource need from clinical teams, and that is information about care pathways, looking at what are those evidence-informed and evidence-based tools and resources that clinicians can use in dementia care. And so on this page, it speaks specifically about risk reduction, detection and diagnosis, treatment, and care planning. And so you could actually start here with one of these topics, or if you continue to scroll down, it actually will take you to each of the categories. So one of the questions we often get is safety. What are some tools or checklists that we can use when talking to families about safety? Also, there's information about that annual Medicare wellness visit and what does a cognitive assessment look like and what should that integration look like for our clinical team, as well as, again, looking at those risk reduction strategies. And often that comes about from family members where if they have cared for multiple family members, they're concerned about their own cognitive health. And what are some of those things that you can share with those family members? And then we have detection and diagnosis. And so, as I shared earlier, we have the biomarker information, as you saw on that landing page. And here it is again. under those clinical practice guidelines, as well as we have the diagnostic evaluation, testing, and disclosure information here on what that looks like again in clinical care, again, looking at those best practices. This actually links to a journal article specific to lumbar punctures and diagnosis. As I scroll over to the right, you can see that we have clinical instruction videos where you can actually watch a scenario of what is it like to explain a diagnosis to a family member. How do you best uh, communicate with family, and what are, again, some of those best practices. And again, the disclosure of diagnosis, best practices, genetic testing. That's another question that we often get in community is, should I get genetically tested because I know that multiple members of my family have had Alzheimer's, and what does that look like? So again, you can scroll left or right, or you can see all of those diagnostic resources here. And now moving down, another question we often get is related to treatment. So what are things that can be done related to behaviors, and what are those FDA approved medications? I'm going to scroll to the right because uh, I love this section because this is something that I would say that is also new, but questions we get often are related to sleep changes. How do we treat that? What are the best practices for people living with dementia related to sleep? Questions about alternative treatment. Sometimes families come in and they'll talk about a treatment and you've never heard of it. This is where that type of information is housed here. Another big one is billing codes. And so that information is here for clinical teams. So again, things related to treatment, all here. And of course, you can always click that green button to see what all of the resources are in one page. And then here, what I showed earlier, the care planning. And so one of the areas, and I'll just click on this for a moment, is we'll take you to our dementia care navigation training series. And you can actually look at why it was created. And this was something we developed from the anticipation of the guide model, which is guiding an improved dementia experience, that actually, for the first time, CMS is actually providing funding for care navigation and respite. And you can learn all about that here, all about the curriculum related to that. And this is really designed for those care navigators and individuals in community. But also, it's a great tool for anyone who is completely new to dementia as a professional, because really this is an A to Z training. But also, going back, there are other trainings and information again that are here that can be utilized by professionals. And so there is a cost for the dementia care navigation training, but there are also other instructional videos and information that are available at no cost. So, and really it's because it's a certification program and it provides CEs. And I'm happy to answer more questions about that later. So I'm going to scoot back here and go back to those content hub uh, um, uh, topics. And one of the topics is research. So when we look at research, publications, and grants, again, questions we often get. And we have those peer-reviewed journal articles that you can actually access. I know a lot of times they have a paywall when you go to Google them, but this is actually an area where you can access those journal articles at no cost because it's a part of our library services. Other types of publications. Another big area, grants. We receive questions about funding for research as well as clinical trials. And so I'll just scroll through here so you can kind of see the offerings here. These are the different publications, research funding, and also information on what we are currently funding or have funded in the past related to research, as well as from families, information about, okay, so how do I get involved in clinical studies? And that is through for the Alzheimer's Association, our trial match. And again, this service connects family, community, healthy volunteers to research that is happening locally or even globally, depending on your search parameters. And it talks about the importance of clinical research and clinical studies to move the knowledge that we have forward and to ultimately get us to where there is an end to Alzheimer's disease and dementias. So I talked a little bit about this already, training, education, and professional development, all here. I will highlight, we do have Project Echo, which does allow clinical teams, professionals to actually have a virtual, it's an all teach, all learn model that we run for primary care. We have it for long-term care communities. We also have it specific to care navigation through the guide model that I shared a little bit about earlier. And so when you click here, you can actually learn more about that offering. And this is actually no cost as a part of our ongoing education in the clinical space. But there is lots and lots of information about the echo practices, what type of education we provide, and definitely something I recommend. And this is something where if you are interested or your clinical team is interested, do not hesitate to reach out to me. I will be sharing my contact information at the end. Another question that we receive, especially for people who are new in their career, are what are some professional networks and registries that I could be a part of? And so this is where you can find out that information. What are some of the membership communities? What are some roundtables, again, where clinical teams, health systems, this is where payers and other organizations get together to discuss dementia care, discuss how we can improve the current system and better support people living with dementia and their families. And so this is also all available here. And again, always circles back to those original hub topics that we saw earlier. And then lastly, I'll share conferences and events. And so we often have global conferences, and I feel like these are actually underutilized by professionals, and specifically those who are new in their career. And of course, our largest gathering, which is the AIC, Alzheimer's International Conference, which is the largest global gathering of researchers and knowledge related to brain health and dementias. And so with that, I'm going to go back to the presentation. Let's see here from current slide. There we go. And again, we talked about these 4 areas. And so one of the things I definitely want to also inform this group is that our AlzPro is mobile friendly. So not only can you access and look at this on a computer, you also, it's a little bit formatted differently, but it is compatible with a mobile device. So with that, I'm just going to share a couple of upcoming events that are happening at the Alzheimer's Association. And one is our healthcare summit. Historically, this has been specific to payers like Blue Cross Blue Shield, United, but now we have expanded this conference to include health systems, healthcare professionals. So definitely wanted this group to be aware. It's a little bit closer to us this year in Houston, Texas, for those of us in the West. We also, again, have these wonderful global impact groups and symposiums. And so this is one that is being held in Istanbul, Turkey, but it is available online. And I failed to say that the previous one, the healthcare one, is in person only, unfortunately. But our AIC has both a in-person and an online component. So this is the big conference, and so this year it will be held in London in July. And so definitely be on the lookout for that. And I believe registration should be opening soon to attend this event virtually. So, with that, I just want to give a brief overview of our community resources, just in case some of you weren't able to attend earlier sessions where we talked about this. The one thing I'd always like to highlight in any presentation is our 24/7 helpline that is at no cost and is open to all, including professionals. And one of the ways I feel that our helpline is underutilized is when a professional is struggling with a specific case or a family issue. You can call us and it's confidential. You don't have to share the client information, and you can just talk through their circumstances or the topic and receive information and counseling from one of our care consultants. So definitely keep this in mind, and feel free to share this with your peers as well as families and community. We also love to hear even from students who are doing projects for high school or middle school and they're interested in brain health or interested in dementia. Please feel free to share our helpline with them, and we will connect them to their local chapter and give them access to those resources. But along with that, we have multiple resources for families, as I shared earlier, the All's Journey. So do not hesitate to reach out to us. And this is my information. And please, again, I love to hear from people in the community and professionals at any point if you have any questions or need our support.